Good afternoon, members. It is April 3rd, 2020. It's 4 o'clock, and we've got a quick meeting here with Chief Rhambo and George Sanchez from HR. Just to go over some few questions here that some of the members have been asking about that we can get answered. Chief, I sent both you and George a list of questions. The other question I failed to add to there was in regards to comp time as well and what the discussions are with that. So if you, rather than me continuing talking, if you can go ahead and just go down that list of questions, you can just read off the question and give your answer if you would.
Okay. So the questions that you sent was, what is the distribution plan or schedule? Have we confirmed that all of our folks have been provided with a supply kit? Are they just for the police and security? Is anything going out to all of LAAPOA, or do they have their own stash? Okay, so to answer the first question, you recall back early March. Actually, we kind of jumped on it sooner than most. We started issuing the Go kits, and it turned out to be really, really appropriate at that time, even though nobody was really paying that much attention to all of this. We were concerned, but we just didn't realize how serious it was. So fortunately, we did that. Really a lot at the urging of a lot of the members too. So the Go kits have been pushed out. We have on hand, as of the 24th of March, we had on hand about 20,000 N95 masks. And you guys realize those N95s require training as well as a medical clearance to wear. We have since issued an order that you only don that mask if you come in contact with someone who's displaying visible symptoms. Distance yourself, put your PPE on, and then address them as usual. And then there's the other part of that protocol is to call the watch commander, etc. What's happened recently is the mayor has issued not necessarily an order, but strongly encouraged all the residents in the city of LA to wear either the scarves, bandanas, and or the surgical masks. Just so everybody, it's like a prophylactic for everyone. He's encouraging all the first responders in LA City to do it, including LAPD and LAFD. LAAPOA has a stash of N95s as well as us. We're trading a large portion of our N95s for triple the amount of surgical masks that we're going to get from LA City. That should happen today. So we're going to get a 3-for-1 return ratio on that. Also, LAAPOA is going to follow suit with LA City, allow all staff members to wear either their personal face masks or bandanas, and we're also going to issue out face masks. And that protocol is being developed. Some of the things we talked about that because LAAPOA is so large. We're going to do them at Admin East, Admin West, have supervisors issue them out to their various work groups. We'll have a stash at APD headquarters as well as over in dispatch. And then ESU and other units can come over and pick those up. Let's see. Everybody will get the regular mask, the surgical mask. Everybody that works in the airport will be encouraged to wear those. And also along with that protocol will come how to properly dispose of that because there'll be biohazard material. So all that's being developed, and we should have something, if not by the end of the day, early next week, so we can start issuing that PPE out to everybody. Let's see. And LAAPOA will have its own stash as well as we still have our own logistics supply chain also. So those are the questions that you had, and then I have some other things I can add on that came out recently.
Sorry, there was a second email which I also, just in case you didn't get the email, I sent you both a text with the other follow-up questions on this. But go ahead.
Okay. Well, just go ahead and ask me because I can't. I'm on my phone. I'm on one device.
Okay, got it.
So
I'll read it off to you.
What was the second question?
I'm pulling it up now. 1 second. What is the plan moving forward in regards to quarantines? Can we get a written plan for criteria of how people are sent home or stayed home, and also in regards to how people are being carried with their time, because it seems that some supervisors are doing certain things certain ways, and there seems to be a little confusion on how that's going about.
Okay, so the protocol has been relatively stable. So since the first 3 positive tests that we had, the protocol has been, if you are in immediate long-term contact with someone who has tested positive, you go home and monitor yourself for 2 weeks, self-quarantine with the 2-week monitoring sheet, and report any abnormalities or illnesses to the nurse whose number is provided in that monitoring sheet, and then you're directed to seek your own medical care while you're out. And this is for people who were exposed to folks that were positive. And exposure is 10 minutes or longer, 6 feet or closer. So like your radio car partner, your police car partner, or you worked a command post, or you did something with them for a prolonged period of time. So you go home, self-monitor. You're carried on, at that point, we carried the initial group on admin leave, so they didn't burn their sick time. But if you test positive, well, let me back up. The initial group went home on admin leave. If you get sent home sick, you can carry your time as sick. If you test positive, you're able to get your time, well, at least apply to get your time reimbursed under workman's comp, in those workman's comp industrial illness forms. But generally, if a person is monitored, let's say you have a family member who you went to a gathering or something, or you visited someone and it turns out that they were positive and you need to call in sick because you need to self-monitor, you're going to be burning your own sick time to do that. And then I'll go over the criteria of people who are actually on admin time until, I believe, April 30th. So if you're exposed, you go home on sick. If you test positive, then you can actually, you're still on sick time, but you can apply for industrial leave. So is there any question about that?
No, that's clear. I just want to be able to put all this stuff kind of compartmentalized in writing. We can even post it up around the station and those kinds of things. And on the call that I was on earlier with some other cops around the state, now that we have 3 cases that may or may not be line of duty deaths, 2 in Riverside County and 1 up in Santa Rosa. It looks like Santa Rosa may have a little more difficulty than Riverside sheriffs, and that all comes down to documentation in terms of the department being able to show reasonably how that person was infected, whether it was work-related or not. Could be the difference on whether they look at it as a line of duty death or not. So we need to make sure that we're tight on all of our documentation of all the people that we have quarantined, all the people who do test positive, that we can track it backwards to somehow, some way, reasonably showing that it was work related.
Right. I've got a document that I hammered out this morning that I sent over for a couple of eyes to take a look at, and you'll see something come out from me later today, if not today, tomorrow. And then LAAPOA HR will be putting out something. There was some question also recently about if you're on who's telecommuting, who can telecommute, who can take FMLA. Our first responders exempt. The rule right now is that first responders are exempt from this FMLA issue. And then the question came up in our department of who's actually designated as a first responder. our security personnel designated as first responders? Obviously, our sworn folks are. And what about our dispatchers? I am aware that in possibly the fourth stimulus, you're taking a look at some type of bonus pay for folks, hazard pay, that are first responders. So I'm really cognizant of the fact that I may have to make sure that everybody is designated as such, so if that bonus does come up and they're at work, they would be entitled to it. The folks that are telecommuting are usually our admin for the conversation in this group. It's our admin, sworn admin personnel that have the ability to telecommute, that do primarily admin duties. Some people have been reassigned to jobs inside the airport, such as the ARC and over at dispatch, because of folks that have been out on identified medical issues that make them vulnerable to coronavirus, and as well as the ones who are we let go on admin that are 65 and older. So if you're 65 and older, you have a medical vulnerability regardless of age, you're allowed to go home on admin time at least until, I believe it's until April 30th.
Along those same lines, Chief, has there been a definitive answer on whether the child care issue is also relatable to the sworn side? Because that question came up as well with folks having potential child care issues with schools being looks like they're going to be closed down for the rest of the year.
Right, right. Again, HR says that that the first responders or the cops, us, and fire are exempt from that. So one of the
I'm sorry, could you repeat that?
It said HR sent out a memo or an email saying that the first responders are exempt from that FMLA. The new one, that there's a federal guideline that just came out on April 1st. That gives up to 12 weeks until December 30th of this year. But apparently first responders are, emergency personnel like us are exempt. But I think if you have a dire need and you absolutely don't have anybody, any support system, I think we'll be able to take it on a case-by-case basis. I wouldn't be opposed to that. I think we have enough personnel. It just depends on how many people we lose behind that.
So should we, if we have a member that has that question or concern or is in that strait, should they just direct that to their first line supervisor and through the chain?
Yep, send it up the chain and then make sure I get CC'd on it.
Okay.
And then I'll evaluate it on a case-by-case basis. And I get it. There are people who have children with special needs that they really just need to be home with. And so I get all of those different nuances. So each case is different. So it's just like when we talked about doing the modified 12 and 12 schedule. That happens if that'll come into effect if we lose a significant number of personnel for a variety of reasons, and that could be one of them.
Okay, very good. Is there any plan to?
I have a further question on that, just for clarification's sakes. Any person that needs to take that sort of time off, they will be burning their accumulated sick and/or vacation, correct?
Yeah, there'll be. So when you look at the new federal law, and I would call HR on that, but it looks like the new federal law allows for the employee to. We're not going to require you to burn your initial vacation, sick, or whatever time. It'll be covered under another federal guideline. But if you fall into the percentages, like you run out of that time, you run out of that federal time, you can actually bridge that to make your check whole with your own time if you have it. So I'm still learning. It just literally came out day before yesterday. I'm still conversing with Paula Adams on that. I'm hoping that they'll come out and come out with something that really explains it. If you look at the document, it has a number of exemplars involved. And Marshall, I'm not sure if you got a copy of that yet.
Yeah, I have it here. I'll make sure I push it out, or have Mike push it out to the membership as well.
Yeah, it's pretty lengthy, and it I need to read it a couple more times just so I clearly understand it.
And Chief, if I can add, when we were on the CAO's call, though it came out April 1st, we're still seeking city attorney guidance on that too. So until the city rolls it out, let's just be status quo for the airport. So whatever we've done, we'll continue to do until we're told otherwise.
Okay. So yeah, so if you have some members that really have childcare issues and they need me to take a look at that and give them some relief, just certainly send that to me and I'll take a look at those.
Very good, thank you. Is there a plan to begin decontamination of the station? And if not, why not? We are aware that a few months back when LAPD had a couple divisions, had a typhus situation, the city did decontaminate both those stations. And we don't feel that it's adequate just having a couple janitorial staff coming down, wiping down doorknobs and doing a little vacuuming. It's just not going to cut it.
Yeah, I looked into that a little bit. I think right now what we're doing is we're on a schedule and they're going over at least twice a day. I've seen them since I've been back at work there, at least twice a day. I know there's some type of device that either shines a light or does something that kills like 99% of the pathogens out there. But I'm not sure where LAPD got that, or if it's a city piece of property, or if it's even available to us. So I'll have to do, once we get off this call, I'm going to make a call over to the city and see, if they still are using that device and how they're using it. Because bottom line is, if we decontaminate the facility, we'll have to do it at least 3 times a day, because people go out and go 10-8 and then come back 3 shifts a day. And then we'll have to do it also several times a day for patrol and secure traffic and SACU.
Okay, and and we can talk offline on that as well, because I do have a line on a company that does do that. It's private, so we would have to look into funding. But if that's what needs to happen, that's what needs to happen. Because again, the wiping down doorknobs is not going to cut it.
Yeah. Well, I think. Yeah. So. But
is there a plan to streamline more testing and getting results back in a timely or quicker manner?
I think right now the city has these sites up, but I haven't seen a plan that allows for first responders to get it at least like without symptoms. So if you have any symptoms, or it turns out like if you think you were exposed, because I tried to get my own personal doctor, and if you guys have a line on a first responder testing without symptoms, that would be great. But I haven't seen that. Have you?
Yeah, other cities and counties, but I mean it's going to take a public-private partnership, and they're setting it up where they're getting turnaround as soon as 24 hours, 48 hours, and they're doing more regular testing. And that's what's going on in Northern California and some other counties up north. The fact that you're starting to have deaths, I think, is really making people realize that you could have more people walking around that are asymptomatic that are still spreading it. And this concept of we're not going to test you until you have results is already spreading the virus. So if it takes us sitting down with the CEO and coming up with some kind of plan for, like I said, a public-private partnership, that might be, because if we just depend on doing the way we've been doing it with the county, that's just not working.
I think what's going to happen in that conversation is it'll go to the mayor's office, and Garcetti and those guys will have to take a look at that. Maybe I could give a call to Jeff Gorell to see if there's anything afoot like that.
Okay, and I can give you the list of what Oakland's doing and some of the others that are more aggressively testing their folks. You already talked about the 12, so I won't. Just so we're clear, we're only looking at going to an A/B shift if we drop below 40%. Is that still the plan?
Yeah, if we drop below 40% for sure. I think, and you guys will realize it because we won't be able to actually adequately staff the airport. Right now, we're tripping over each other because it's just so slow. And we're going to be shutting down some terminals pretty soon here, probably. So we'll still need to be out there making sure that folks aren't entering those areas that are shut down. But clearly, like the traffic deployment and the patrolling issues, like LA exit is almost empty. But we still got to be vigilant because this is a time when people start acting really silly out there.
Right, and despite the issue of a staffing, I know we talked about this before. Is there any plan to do some not an A/B watch, but maybe a modified 12s, which the proposal was sent out because, like you said, we're not only are we tripping over each other, but the other fact of it, if this is going to be a prolonged issue, and putting into childcare and all these other things by limiting or reducing the staff that we have there and having more people in reserve. Is there any further conversations about that idea?
Not yet, but I did see the breakdown. So I would imagine in the next week to 10 days, it'll be a serious conversation. Okay.
And this might be more of a question for you, George, but is the airport planning, or are you hearing anything about potential furloughs or layoffs? And if so, is that at any impact to Sworn? I mean, we were told that there's a hiring freeze, but can we get clarification on whether that hiring freeze or these potential furloughs or layoffs do impact Sworn?
The furloughs or layoffs, I haven't heard anything about that. The piece on hiring freeze, that excludes public safety. So from my understanding, that's what it excludes. I haven't heard anything other than that. That was rolled out first. So that's my complete understanding, unless I've misunderstanding. Chief, you've heard anything different?
I have not. I verified that with Director Adams as recently as 24 hours ago. So public safety. So we're still hiring cops and security because we still got to staff the MSC at some point. It may not open on time, but we still got to staff that. And then we also have some attrition and things like that. We had people in backgrounds and setting up for academy dates and things like that.
Okay, and then last question. We spoke about this before as well in our MOU 30. There's provisions in there for comp time or CPTO time, and it's also listed in the LD system already. Is there any further discussions about implementing that to keep the continuation of the operation rather than shutting things down to avoid overtime? And can we get some kind of clear guidance so that all supervisors are on the same page as to the process to calling you or emailing you or texting you in regards to overtime, so we don't have another case where we have a felony arrest and guys are sent home and told to do the report the following day when you've got a felony suspect in custody, and making our people look bad personally.
Yeah, so I'll cover that part first. I sent out a email, and I had a conference call with the assistant chiefs and the commander of our operations about that very issue, and reiterated, the fact that the edict technically is there's no overtime. There's overtime, and people understand, look, late arrest, chain of evidence, that kind of thing. All they have to do is call me or email me or text me. I have to go up to the director, who goes up to the CEO, and it's worked at least once before, and it'll work in the future. So I'm not saying that it'll never happen again. I'm just saying that there's a mechanism for it, particularly for like late arrests and things like that, or evidentiary chain of evidence stuff. The comp time issue, you saw an email that I sent over to the executives about that particular issue, and I think George and those guys have had some preliminary discussions about that. I've got to get back to you, George, with some numbers that you asked for. They shouldn't be that high. I'm going to use some existing numbers based on historic overtime issues. And then my suggestion would be that it be allowed. If they ask me, I'm gonna suggest that it be viewed as a viable option.
Okay, very good. And I know it's approaching the 2:30 time that you guys got to jump off. But the last question, it's the elephant in the room, and everybody's been talking about it and asking about it. But what, if any, discussions are being talked about the contracted police services that are at LAAPOA?
So in that same email that I sent over to George, I think it might have been that email, but I've had conversations with the CEO about that issue. So just everybody needs to understand that whether it be political reasons or whatever the reasons, financial, that is not going unnoticed, and it has not gone without conversation. And when the conversation gets serious enough, I'm sure that'll be brought up. And I've also brought it up with the LAPD side also. So there'll be no surprises on that. So everybody's aware that we are thinking about it and talking about it, and that it has to be something that should be considered before we lose any of our members. At least that would be my position.
Yeah, and I'll second and back the chief up on that. So, yeah, those conversations have been had.
Very good. Thank you both for your time. Have a safe and blessed weekend, and appreciate you calling in, and we'll push this out.
All right. Thank you, guys. I appreciate it.
Thanks.